Hello everybody, welcome back to my channel. My name is Vivian. On this channel I talk about nursing, lifestyle, motherhood, beauty and all that good stuff. Today we're talking about the new NMC test of competence and what we know so far. So this month NMC has told us they're rolling out new test of competency come June 2020, and so following the various webinars going on, this is what we know. Okay, so first and foremost, NMC have been doing a lot of changes in the examination, the review of the examinations, changes to the English test, language testing system, and the scores for qualification to do CBT. Nursing Associate program has been launched, and then a new test design partner was appointed. Okay, so all these changes have been ongoing with the NMC, and it's all been leading up to this new test of competency that are about to start in June 2020. Further to making things easier and better for registrants, new overseas process for registration was launched, as we all are already aware. So the NMC has been trying its best to increase the capacity of test centers, as we already know the number of test writers has increased significantly, and continuing to work with others to ensure high quality of nurses and midwives come into the UK to work, especially from overseas. Okay, and they have all gone ahead to introduce unit test of competency to this effect to reflect the standards of nursing and midwifery that were updated in 2019, as I mentioned in my previous video, and the blueprints for nurses and midwives. The test of competency, which will be a combination of proficiency skills and procedures included from the blueprint, and a comprehensive review of the current test of competency, encompassing feedbacks from stakeholders, candidates about the current test of competency, and complaints and learning from lessons in the previous test of competency, review of complaints, appeals, and lessons learned. So the NMC has appointed a new test design partner by name Alpha Plus. They are involved in designing, assessment, and examination for a range of clients, the NMC being included in that list now. The key design documents for this test partners are the NMC blueprint, nursing standards of nursing and midwifery, their test specifications, and the test design structure is that the CBT is going to be in a part A and B, numeracy and theory. Numeracy 15 marks lasting for 30 minutes, theory for 100 marks lasting for 2.5 hours. And the OSCE is going to have 10 stations, 4 API, 4 skill stations consisting of 2 pairs of 2 skills and 1 professional behavior. And this is going to last for 2 hours 45 minutes. Now this OSCE test is going to have 4 API, 4 skill stations, 2 pairs of 2 skills, professional behavior, and 1 critical appraisal station. I believe this is going to be a very critical station that you should do well to ensure that you pass. Moving on to the CBT examination proper. The CBT examination is going to follow thus: the sample is separate A and B, assessed and filled independently, which is going to last for 30 minutes, 15 marks. Constructed responses of 1 or 4 multiple choice questions. The numeracy includes straightforward questions in clinical context. So it's going to be clinical context, clinical related, and they're going to be straightforward. And the good thing is that a calculator can be used. We're going to be seeing examples of numeracy questions. Here goes example number 1. What amount of fluid has been drawn up in the syringe? This is a basic numeracy question, and as you can see, it's 1.5 that has been drawn up into the syringe. It deals with numbers, it deals with medication, and it's used in a clinical setting. Example number 2. A young person has been prescribed 15 mg of diclofenac. How many tablets should be administered? And it comes in 25 mg tablets. Of course, it's going to be 2 tablets. Example number 3. You have cefazane 125 milligram in 5 mils. Each child has been prescribed 175 milligram cefalzane suspension. What volume should be administered? These are straightforward questions. In the part B is the theory part, where which you will be asked questions existing from the bank and new questions that have been written up, and will cover a range of standards and Bloom's taxonomy. So Bloom's taxonomy is the clue. So go up and read your Bloom's taxonomy. All nursing tests are 90% generic and 10% field specific. Here we have example of a theory question. A patient has temperature of 38.9. What is the nurse's next action to provide comfort to the patient? Choose the correct answer. Keep the patient warm and provide warm clothes. Inform the doctor and wait for them to see that the patient before any action is taken. Warm sponge and the patient and give them a warm bed bath. Provide a fan, increase cool fluids, and administer prescribed paracetamol. The answer here is D, of course. Going forward to the next question in theory, example number 2. A nurse is performing CPR on an 80-year-old lady. Why does the doctor request that the patient's dentures be replaced in the mouth? Choose the correct option. So the dentures do not get lost. A, if the family witness dissociation, they see the patients as they normally would look like. Dentures will give the mouth structure for airway management because the dentures help to open the airway. The answer is C here. Dentures will give the mouth structure for airway management. Now I believe this is just even classifying these answers according to A, B, C, D: airway, breathing, circulation, disability, and exposure. Okay, so if you can understand the principles of A, B, C, D, you should be able to answer any of those questions. Let's go to the structure of the OSCE examination. So the OSCE examination is going to have API, as we already know, skill 1, 2, 3, 4, 5, 6, and we already have the kind of scenarios that are going to be played out here. You have pneumonia, subdural, anxiety, UTI, hernia, asthma, chronic cardiac failure, ectopic, and we have new type of scenario: dementia, confusion, leg ulcers, and diabetes. Okay, now this shapes in this box is showing areas where there will be very new obvious changes. Okay, for example, the skill 5 and 6, which is going to be testing behavioral professionalism of the nurse, and the critical appraisal and evidence-based practice. We're going to look into the changes which have been proposed into the API. And so in the API, the NMC has decided that it's not just going to be taking your vital sign as it is now, but then you're going to be assessing the patient from A to E: airway, breathing, circulation, disability, and exposure. Okay, so to reflect the current clinical standards, planning is going to remain the same. Implementation is going to be drug administration as it is, and E is going to change to XBAR. I'm so excited about this XBAR, where you're going to be telling the examiner who is going to be the health professional you're reporting the situation of your patient to. So it involves giving a situation, giving the background, your assessment of the patient, and your recommendation for the care of this patient. This is something that you will find very useful as it's already been practiced in clinical settings. Going on to the OSCE, we're going to be seeing a couple of skills: in-hospital resuscitation, aseptic non-touch technique, catheter specimen collection, intramuscular injection, removal of catheter, administration of inhaled medication, fluid balance, urinalysis, subcutaneous injection, in-hospital resuscitation for pediatrics, for pediatric nurses, removal of catheter, subcutaneous injection, infusion giving, and VIP assessment, which is basically assessing the cannula site for infection, and blood glucose monitoring. I believe this is not too difficult because we can readily assess and you can readily know what blood sugar levels are. Now, in the example of evidence-based practice, you have questions as this: you are working in the medical ward looking after Donna Jones, a 55-year-old. She is known to have coronary heart disease. She was admitted to the ward with severe chest pain, which is now resolved. She asks you about her pain and states that her symptoms were not like those in the information booklets. She describes that she experienced shortness of breath, pressure in her lower chest, upper abdomen, dizziness, lightheadedness, upper back pain, and extreme fatigue. In accordance with the National Midwifery Code, you are aware that all care must be evidence-based. Please review the 2 pieces of evidence regarding female chest pain supplied Based on the information supplied, please write bullet points appraising the strengths and limitation of the evidence. Now, this is where I think the NMC has raised the bar with the OSCE examination. We're going to have to be doing critical thinking and scientific reasoning of evidences and supporting what you're doing as a nurse or what has been done by a nurse. Whereas patients give you situations and it's not what you've read that you're finding out what you're going to do in that situation. What are you going to support? What are you going to tell the patient? This is a whole new game. Okay, so but then we'll learn as we go. We're gonna go read and research all we need to do just so we can be on top of this situation in evidence-based practice. This is basically using evidence that has been gotten through research, through studies, to support our practice and decide what sort of practices and treatments we give to our patients. And NMC has gone ahead to give you guidelines of how to answer the questions, focusing on the main findings and how the findings relate to the question asked in the scenario. The questions now being what the patient is requesting to understand why her situation is different and what advice does it contain. So, however, these evidence-based questions may look very daunting. Just remember you have support materials, okay? And they have said that the support materials are going to be comprehensive and a picture of what is expected from you. And it's going to be streamlined to keep it simple, as brief as possible, with 3 examples of tasks and questions they are going to find in real life situations. So, and the test, so they promise that you're going to get to see what you are going to be asked, but in a different way. It will be easy to locate and accessible to everybody and to be made available as soon as possible from April. These support materials are going to be characterized by the following. They're going to be formal nursing standards, NMC blueprint, and the test specifications, candidate journey and overview documents by the nature of care in UK, and the chief examiner report after a period of live test use. In addition, the CBT support material will involve guidance for before the day, guidance for on the day, practice tests of 15 numeracy questions and 50 theory questions. This practice test will be available in the online testing system, so we'll give you a true representation of what you are expected to do in your examination. And additional numeracy questions are also going to be available for you to test. So the NMC is giving adequate support for test takers for these examinations, and they're not leaving any stone unturned. So even if it's going to be a new test, it's not totally different. At the same time, you're going to have all the adequate support you need, because I know that you can never be left in the dark, okay? Because if that happens, they're going to get feedback, very dangerous feedback from the new test. So it's in our own best interest that they do all they have promised. Okay, so you just be rest assured that you're going to have practice test questions that you can build upon to prepare yourself for the examination. As for the OSCE support materials, it's going to be overview of the OSCE guidance before and on the day, sample materials, and the forms that are going to be filled in the OSCE practice stations, marking guidance, including guidance on the red flag use and top tips. Okay, so what else can we ask for? Everything has been made available in the CBT. The numeracy part, we're going to have the ability to use our calculator, okay, and we already mentioned all the skills that are going to be coming in and the new skills that are being introduced. These new skills, you just have to go and read mental health capacity for dementia, dose, deprivation of liberty, and study your blood glucose. This is me saying I wish you all the best in your examination. I know you can do it. If you like this video, like, share, subscribe, and I'll see you in my next video. Thank you for watching. I love you as always. Bye bye.